Higher levels of estrogen will increase thyroid binding globulin, so that will hold on to your thyroid, rendering it inactive, creating more thyroid complications. Welcome to Hormone Series Part 7, the finale. I will quickly recap on the physiology of hormones. And so we're going to start with cholesterol is going to produce a pregnenolone. So that is the precursor to all of your hormones. So now you'll see we got a couple different pathways. We got pregnenolone that can go to progesterone, and then that progesterone will go to androstenedione, and then that androstenedione can either go to testosterone or estrone, where it'll aromatize to estrone. That is your weaker form of estrogen. And then testosterone, it can convert to DHT, which is 3 times more potent than testosterone. This is where you'll see like a lot of hair loss, for example. And then that can aromatize into estradiol, where estradiol can either convert back and forth between estradiol and estrone. Estradiol is your, we'll call it in females, your queen bee, your most effective, healthy estrogen. Very crucial in males as well. Let's not give estrogen a bad name. But estradiol can also convert to estriol, and that estriol is not as weak as estrone, and actually has some anti-inflammatory properties when it's in optimal levels, but we don't want to be shuttling everything from estradiol to estriol, so that's important to remember in that context. But pregnenolone can also go to DHEA, which DHEA then goes into androstenedione and down the list, or into DHEA sulfate. So that's just like your basic steroid pathway for your hormones. So now I wanted to quickly tap on this one here, stress effects, meaning this is what happens to, or this is what can happen to your hormones when you get stressed out. So I mentioned in previous videos the pregnenolone steal, and so essentially what happens is pregnenolone convert to 17-hydroxyprogesterone or progesterone. This is where, like in women, you'll see more from the corpus luteum, so the breakdown of after ovulation, and this can go into cortisol or corticosterone, which then can go into aldosterone. So this is where, remember, we need cortisol to survive. So if you're under immense amounts of stress, whatever that stressor be, your body needs to produce a lot of cortisol, and it will steal it from pregnenolone and progesterone. And this is why we can get a trickle-down effect of not producing enough androgens or testosterone or estrogen. And that's how we tank our hormones. And then this aldosterone is, think of it as fluid retention. So it's going to cause a lot of sodium in the blood, and it's going to bring on a lot of subcutaneous water and like extracellular water. And so this is what's going to give you that water retention, that puffy look. So this is where stress really creates water retention. So that's just a quick recap on the basic physiology of your sex hormones. Okay, so quick recapping on the common causes. Stress. I've said it 1,000 times. We've gone over stress an immense amount within this or any other content that I've ever made. Remember, when I say stress, not just talking work, emotional, relationship, perceived. I'm talking the environment you live in, the air you breathe, the water you drink, the food you eat, your digestion, infections, all that kind of stuff. That is all stress. And because how it will greatly impact hormones, but the most commonly is that pregnenolone steal, or how it's going to disrupt other systems like thyroid and whatnot, which has an effect on all your hormones. So stress is the number one cause. Kind of up there with that is also probably endocrine disruptors. Once again, you're talking plastics, heavy metals, chemicals, things found in perfumes and beauty products, and your laundry detergents and all that kind of stuff. And this will like mimic, you get xenoestrogens, for example. So your like estradiol isn't going to bind to the cell, and then you get estrogen dominance and such things like that. So that's where endocrine disruptors come in, because they are a big culprit of hormonal issues. You're just riddled with toxins in the society. It's not a matter of how toxic, or if you are toxic, it's a matter of how toxic are you. So malnourishment, that's a big one, because this can also go into stress with overtraining, for example. So if you're overtraining, you're burning through these calories, you don't have enough substrate, whether that be dietary fats or whether that be micronutrients, coenzymes, cofactors, minerals, whichever, that help promote the production of your hormones. So malnourishment is a big one, especially when you're talking like low-fat diets and overtraining. Poor detox. I've already gone over detox. I've hammered that one pretty hard. I'm going to do a whole separate video on detoxification, but this is a big one here because with poor detox, you're not ridding of your endocrine disruptors. You could have trouble flushing cortisol, so they stay in high levels, which creates inflammation. You're not getting rid of estrogen, that kind of stuff. So that can really create hormonal imbalances and give you these symptoms of high or low hormones. So this one's a really, really big one, making sure that you're methylating properly and that you're giving your liver the adequate nutrients to perform detoxification. And then inflammation and chronic illness, which pretty much falls under stress. And so when we're talking inflammation, once again, could be all of these, could be, gut issues is a really, really big one. Underlying gut infections will have a tremendous impact on hormones because of hormone production, neurotransmitter production, hormone clearance, neurotransmitter clearance, and just like bacteria releasing toxins and whatnot. And that low-grade inflammation is going to really disrupt that hormonal imbalance. Also, it's going to have big effects on your thyroid. There's going to be poor conversion, high levels of cortisol are going to shut down the thyroid. So there's a lot of stuff like that. So these are ones that you'd be surprised. A lot of people think they're okay, when in reality, they have some sort of underlying condition, whether it's an overgrowth, whether there's a virus, a parasite, or something that's been lingering for a very long time. So then they go and they try to address these hormones with supplements or whatever, or even feeding up, right? Improving the malnourishment, which is then feeding into that underlying condition. And this is why I've mentioned this prior, when women, you want to feed up, you want to build that booty, you want to create these hormones, you want to fix yourself, which requires feeding up. But if you have that underlying condition, you're feeding into that and you're not going to get the optimal results. So it's important to look after this and making sure that you're not suffering from this. And if you are, to take care of this first before you start, which I'll kind of get into and how to address. So when we went through the symptoms of like high or low, you notice there's a lot of overlap, right? Just because of how the steroid pathway goes and how these hormones function, especially when they're in balance. So the most common that you'll see with all of them, obviously in females, irregular or lost cycles, or we could even say like heavy PMS symptoms, heavy bleeding, things like that. Depression and anxiety, especially when you're talking like high estrogen, because estrogen will create over-excitatory neurotransmitters, mood swings, lack of motivation and stuff, low levels of dopamine, weight loss resistance, whether that's due to inflammation from excessive hormones or just not having the nutrient partitioning effect because your hormones are so low. Remember, estrogen is good for insulin sensitivity, testosterone is great for nutrient partitioning, and progesterone is great for your ability to digest fats or utilize fats, we'll say, okay? Thyroid complications, especially if you are using birth control, okay? Low hormones are going to cause like higher levels of cortisol, but that is in return is going to affect the thyroid, essentially either causing your beneficiary active form to convert to reverse T3 where it's inactive, or simply just not convert at all, or not even signal to create thyroid. There's many factors in there that could be contributing to the thyroid complications. Swelling, watery, puffy. Once again, we looked at the pregnenolone steal that can cause that, or higher levels of estrogen can cause that. Higher levels of estrogen will increase thyroid binding globulin, so that will hold on to your thyroid, rendering it inactive, creating more thyroid complications. So that's where, once again, looking at optimizing estrogen can have an impact on your thyroid. And then muscle and bone loss, low levels of estrogen. Remember, estrogen is important for muscle retention, same with testosterone for both bone and muscle. So those are crucial. Hair loss. So we're talking higher levels of DHT, for example, could be one creating that hair loss, or we could have unwanted hair growth. So higher levels of androgens and testosterone, like women with PCOS, for example, or endometriosis. Chronic fatigue is a really very, very common one. And then obviously sleep issues, neurotransmitter production, cortisol swings, etc. So those are some very common symptoms of a hormonal imbalance. So now going on to how to address. So step number one though, what is it? Always consult your healthcare professional prior to any of this stuff, okay? I have provided in the previous video supplements, strategies, whichever. They could be absolutely useless for some individuals without the proper testing and without the proper guidance. There's so much context involved in this, but as mentioned, what I have provided can give you a good foundation to begin working on these things, or going to a healthcare professional, getting the labs done, seeing what we've talked about, and now you might be able to implement these strategies more effectively, okay? So that's number one. Seek out your healthcare professional and get your labs done, okay? But if we're talking high estrogen, remember, I'm going to keep this very short, summary, and basic, improve detox, improve that estrogen clearance, which will also improve the clearance of endocrine disruptors, lowering those estrogen levels as well, okay? And low, eat more. Raising your food intake or raising your calories will help produce more hormones, resulting in more estrogen, okay? A healthy way to raise estrogen. Pregnenolone and progesterone, if they're low. Remember, we talked about it's very rare that they are high, so we're just gonna focus on low. Eat more and do less. Pregnenolone steal. So by eating more food, we have more substrate to build these hormones, and by exercising less or managing our stress better, we are significantly reducing that chance of stealing from that pregnenolone. And then now testosterone. If we are high, we're looking at things probably like polycystic ovarian syndrome in a female. Right? Men too, obviously not PCOS, but inflammation can create high levels of testosterone. So decreasing that inflammation, whether that be improving insulin sensitivity, taking care of a gut issue, chronic illnesses, whatever it may be, decreasing inflammation is the broad diagnosis there. If it's low, eat more, right? Once again, eat more so you have more substrate to build these hormones. And then supplement. And so you could use things like Humanofort, boron, maca, things like that to help improve testosterone levels. But if you are over the age of 35, then it might not be super effective. That's where you can go look at a TRT clinic and talk about testosterone replacement therapy. But remember, if you get diagnosed via labs with low testosterone, look at every other aspect first. Don't just hop on TRT. You might not need testosterone replacement therapy. You might just need to improve your nutrition and decrease your stress. And maybe if you're not training, train some, because that can help promote testosterone production. DHEA, once again, if it's high, decrease inflammation, okay? Also manage stress, because remember, DHEA can go both ways when dealing with high levels of stress. It can either rise or it can either lower, okay? And then low, eat more, do less again. Same aspect, because if we're stealing from pregnenolone, we are not producing DHEA. And then in the right circumstances, if you have a Dutch test or a way to check your androgens, if DHEA is low and your androsterone and etocolanolone are low, then you can look at supplementing DHEA, okay? Then androgens, if they're high, decrease inflammation. Excessive training can lead to high as well. Remember, it can lead to less also, but it can also lead to high via an inflammatory response. So reduce that inflammation, okay? Once again, you're talking like a form of polycystic ovarian syndrome can create high androgens. So overall, decreasing that inflammation will help lower those androgens. You could also use, once again, saw palmetto, stinging nettle, for example. But remember, that's going to go into estrogen. So make sure you are detoxifying your estrogen, okay? And obviously do less. Manage your stress is a good way, because stress can raise androgens. And if they're low, eat more. All right, as you can see, that's pretty. Any low hormone is most likely going to involve eating more. But as mentioned, I can understand, especially females, when they try to eat more, they kind of get a negative response. There's an underlying condition, okay? Eat more is still the solution. You just have to fix that underlying condition for eat more to be effective, okay? Training. If you're someone who chronically trains, train more is not the answer. If you're someone who doesn't train at all, training can help raise androgens to an optimal level with the proper training program. And once again, supplement when it comes to increasing androgens. That's what we're looking at. SARM, selective androgen response modulators. So that's a big one there, okay? So that is the recap of the hormone series. I kind of rattled that off really fast. You know, like I said, you'll learn a lot more if you refer back to the previous videos, but here's a very basic summary of this hormone series, okay? I really enjoyed making this, and as you know, as my career progresses, we may redo this. We may come back. You know, I learn things every single day, but right here I find with what I practice, it's been effective at, you know, especially treating women with hormonal imbalances. So yeah, so hope you guys enjoyed that. Hope you enjoyed the whole series. And if you guys like that video, please hit the like and subscribe button and follow me on Instagram at that.coach.curtis.